Thank you so much.
Welcome.
Next, I'd like to introduce Andrea McDowell and to be followed by her child, Echo McDowell. Start with Andrea here. So Andrea has worked in the environmental field on climate projects for over 20 years, most recently for a public health unit, and she's been an environmental advocate and activist since high school. She is also a type 1 diabetic and a single parent to a disabled teenager. We're really looking forward to hearing your perspective, Andrea, and I'll just put the question to you again, just to remind you. But so given what you've seen in your personal experience, and your professional experience for that matter too, what impacts do you see climate change having on children, and how would you advise parents to engage in mitigating those impacts?
So I'm going to be answering this in a very roundabout way. I hope you enjoy, and I hope the Zoom doesn't cover too much of the text. So I have good news. We can wrap up our climate action and go home. It's true, we're all done. We haven't solved climate change, not at all. On the contrary, it's well past solving. No, as it turns out, we're just moving to Mars. And it really looks lovely, doesn't it? I bet it's even nicer in springtime. Or maybe this is spring, it's hard to tell. We gave it a good try, but it's too late. The climate crisis is here and it will only get worse. Don't shoot the messenger, it's physics. Carbon is pretty well permanent once it's released and doesn't even begin to affect the climate for about 30 years. Meaning that as bad as things are right now, we're only dealing with the emissions up until about 1990, and not even the peak of those. The emissions up until today won't begin to affect the climate until the 2050s, and won't peak for decades after that. Our poor old planet is a lame horse, I'm afraid. Still breathing, but why? Put it out of its misery. I'm a type 1 diabetic and have many disabled people in my circle of friends, and I've learned a lot about whose lives are worth living. Spoiler, it's not ours. I had one friend whose daughter had a congenital liver disease and ended up ultimately needing 3 liver transplants as a young child. My friend had a blog about this and found an online forum discussing it, in which strangers called her a terrible mom. Her daughter would have been better off dead. Less unnatural, less suffering. That poor kid, all those surgeries. That poor kid is now in college. The point is, we know for sure that some lives have value and others don't. We don't know very much about Paleolithic cultures, but we are quite sure that disabled people back then would have been picked off by cave lions in a jiffy. So extending their lives now is just unnatural. I've been told that the planet would be better off if I, for example, were dead. It's nothing personal. The planet appreciates my activism and commitment and thinks I'm swell, but diabetes, you know? All the syringes and pen needles and test strips and insulin vials are all made out of plastic. And if there's one thing we should ban immediately with no exceptions, it's plastic. It's sad that some people will have to die, or okay, a lot of people will have to die, but it's for a worthy cause. Climate change is going to kill a lot of disabled people. And again, it's nothing personal. It just happens that extreme heat is very bad for people whose bodies can't regulate temperature. And increased flooding and ice storms are very dangerous for people who use mobility devices. And power failures are terrible for people who rely on electrical medical equipment or who need to refrigerate medications. And this is just natural. Hurricane Katrina, for example, about half of the deaths from that storm were disabled people. You could complain, but why? Just because disabled people weren't involved in any disaster or emergency response planning, and the evacuation vehicles couldn't accommodate mobility devices, and no one had a way of getting wheelchair users off the top floors of buildings when the elevators went down, and emergency shelters didn't have medical services or access to medications, and food planning didn't take into account medical diets, that doesn't mean it was anyone's fault. So that's probably not what you were expecting, but I run into a wall when I talk about disability and climate change. If we put this in the context of divorce, it would be easier. No matter how shattering the divorce or how permanent its impact, you're not better off dead. 100 years ago, though, single mothers were seen as unnatural, and society treated them as a problem to be eliminated. Diagnosis as mentally ill, incarceration, and poverty. Now we see that as sexism, not biology. But we still see disability as unnatural, and we act accordingly. We work to either eliminate the disability or we pretend it doesn't exist through institutionalization and inaccessible communities. We still see the difficulties that disabled people face as one intrinsic to biology rather than society. And humans aren't actually the first species to profoundly alter Earth's atmospheric chemistry and bring about a mass extinction event. But we label this one as unnatural. We have this idea that civilization and the things that humans do are outside of nature, even though nothing is outside of nature. Because we see our ecological collapse as unnatural, we put ourselves in the same bind, eliminate it or ignore it. And since we can no longer eliminate it, many just want to escape. Disabled people living well can also be seen as unnatural. We're positioned in the collective imagination as objects of pity or recipients of care, but not as people with skills, resources, contributions, talents. Here's a short list of what I've read from disabled people about what they could bring to climate leadership: resilience, experience in overcoming obstacles and living in an environment that seems to want you dead, living within limits, valuing lived experience, and seeing that as expertise, democracy, if not exactly consensus, then an activism model that leaves no one behind. Critique of the notion of productivity and consumption as the foundation of life, the model of community care instead of notions of independence or individualism, mutual aid, and living in an uncertain future. Of course, disability, particularly in our society, does create vulnerabilities, and these need to be addressed, but not from a place of charity. We could tackle the ideas of natural and unnatural that ableism is based on. We'd approach the climate crisis from a better place. Doctors often need to deliver a diagnosis that can't be fixed or cured, and you'll know, as Echo and I do, that when you can't fix it, you do everything you can to prevent the worst outcomes and then focus on living well with the outcomes you can't prevent. And our children too are not just recipients of care. They have knowledge and skills. Today's kids did nothing to create the problem, but they'll spend their entire lives dealing with it. They don't just need parents and guardians to speak for them, but as Dr. Bell said, they need places in which to speak, to share, and to lead. Increasingly, they're doing that regardless of what we think. And maybe that strikes you as unnatural. I mean, who expects disabled children to contribute to global climate action? Can you imagine? That's it.
Thank you so much, Andrea. Really, really powerful. Thank you so much to take in there, and we really appreciate that, sharing your perspective. So powerful to hear you speak around equity and perspectives and vulnerability and that connection with nature that we really need to foster, and the need to have all hands on deck and all perspectives honored here. Thank you so much for bringing that forward. And I know that I'm looking forward to hearing Echo's thoughts, and of course we can delve into more a discussion too with our guests and our other panelists as well. Thank you. If it's okay, I'll invite Echo to speak.